Hey everyone, good morning, and thank you very much for joining us. As Karen said, my name is Caitlin Kiska, and I am an analyst with the Michigan Healthcare Security Operations Center. Thanks for joining us for Always On, How Alert Fatigue Endangers Cybersecurity and Lessons from Other Industries. So who are we? Who am I? I am an analyst with the HSOC, which is an advanced cybersecurity capability created for healthcare providers by healthcare providers. And on an aside, I also really like birding, so feel free to also put bird-related questions in the chat as well. And I'm joined by Leanna Stewart, who I don't know if you want to say hi really quick, Leanna.
Good morning,
Leanna is,
everyone.
yeah, Leanna is the manager of the HSOC. So the goals of the webinar today are to communicate how decreasing alert fatigue decreases human error. We're going to be discussing lessons from other industries who have taken a more proactive stance on combating alert fatigue. And most importantly, we're going to communicate that alert fatigue, it's primarily a safety issue for organizations, in addition to contributing to burnout and fatigue on an individual level. And just kind of for the sake of simplicity, not splitting hairs, just a few umbrella terms. We're going to use the term today, alert fatigue, as opposed to alarm fatigue. A lot of times in healthcare, it's referred to as alarm fatigue. I view these as mostly interchangeable, but again, today we're going to focus on alert fatigue. We're also going to use the term operator. We wanted to pick something that was industry neutral, and the operator is the employee, whether it's a cybersecurity analyst, an engineer in a plant, a nurse, a doctor, who is actively using and operating the system that is causing or used to address the alert. So let's begin. So what's alert fatigue? Alert fatigue is when an overwhelming number of alerts desensitizes the people tasked with responding to them. Alert fatigue causes alerts to be missed, deviant activity to be labeled as normal, and responses to be delayed. And just overall across the board, it's a source of human error. And while the primary focus of our webinar today is not to talk about mental health or burnout, it definitely contributes to some of the things that we're going to be speaking about. And it cannot be underestimated. Alert fatigue can cause burnout, anxiety, and huge amounts of stress for the people who are undergoing it. So in healthcare, the Joint Commission, which issues accreditations for hospitals, made combating alert fatigue in hospitals a goal in 2013 following multiple patient deaths. And there's a huge bevy of research about this, but just a quick statistic, for example, just to tell you again, we're not being overdramatic about it. The Food and Drug Administration reported more than 560 alert-related patient deaths in the United States between 2005 and 2008. In 2015, the Joint Commission also included alert fatigue in their Centennial Event Alert as an emergent safety issue associated with IT. So again, just recently too, they've kind of reaffirmed that they do find alert fatigue to be a safety issue. In industrial systems, alert fatigue and miscalibrated alerts are behind many of the most notable and deadly industrial disasters in recent history. The Texas City, Texas explosion, for example, the Deepwater Horizon disaster, which besides the fact that it cost multiple people their lives, was also a huge, epic ecological disaster as well. Also, it is associated with Chernobyl and everything that went on in Chernobyl. And as alert fatigue can lead to deadly errors in industrial systems and healthcare and aviation, entire fields of science have been developed around it. And because this is something that we have to work with in cybersecurity as well, we need to leverage this existing research from other industries in order to help combat it. So where are we right now in cybersecurity? Because again, there's a vast amount of data to illustrate that alert fatigue is a problem in cybersecurity. And on an anecdotal level, I have never met one person who doesn't think it's an issue. Just to kind of show where we are today, 63% of IT professionals across the board say that alert fatigue is an issue. And this is most concerning to me. These are more statistics about cybersecurity. These are from McAfee, these next three. 25% of cybersecurity analysts receive more alerts than they say they can investigate. 31% of analysts sometimes ignore alerts because there are just so many false positives. And 40% receive alerts that just lack any actionable information to investigate at all. And also here to show exactly where we are, this is a study from the Ponemon Institute up in Traverse City, very, very reputable, about what makes working in a SOC painful. And I know I work in a SOC, this is not necessarily indicative of my SOC, but I want us to look at this again, not from the perspective of mental health, but from the perspective of information security. So 65% of analysts say there's just too many alerts to chase. 65% say they have information overload, and 58% say they have an inability to prioritize threats. And if we look at this again as a threat to our data, we can see how this can create this almost like perfect, disgusting stew for a hazard to happen. And one of the ways this was exemplified was the target breach. And this is basically the classic example of alert fatigue affecting an organization. And in 2014, Target had a breach which cost the company 252 million, so $250 million with a B, and it also led to the resignation of its CIO and CEO. And one of the kickers here is that one of the company's security products correctly detected the breach. The people who made the product made no secret about this. They put it everywhere. Their company did detect the breach multiple times, but due to the high volume of alerts and the frequency of false alerts, the company's IT security teams just didn't catch it. It just got lost in the muck. There were too many alerts, too many false positives. And a rough estimate places the amount of alerts Target was receiving at 10,000 alerts per month. And we really need to take the target breach and learn from this, and it shows perfectly that we need to frame conversations in cybersecurity about alert fatigue in terms of safety. And in cybersecurity, many conversations about alert fatigue have focused on burnout and mental health. And simply put, there's always going to be people who just do not care if their employees are burnt out or under stress due to alert fatigue. People like these two gentlemen on our right, which this is our first Easter egg of our little presentation today. The first person to type in the chat who these two horrible bosses are who definitely wouldn't care about alert fatigue will win a prize. But in order to take alert fatigue seriously, conversations in cybersecurity must be framed in terms of safety for the benefit of the operator and the benefit of the organization. Again, we need to think about target. And it must be emphasized that an abundance of alerts that can't be triaged in a timely fashion, or alerts that are not maintained, at the end of the day, they are dangerous for the organization. They're a danger to the information we're trying to protect. And what we need to remember is that at its core, alert fatigue is a source of human error. We cannot change the human condition. We cannot change that humans are occasionally going to make errors. Humans are occasionally going to make mistakes. But what we can change is the conditions under which people work and ensure that they are working in an environment where they make less errors. And if we're going to discuss making less errors and how human errors endanger security, we have to take a slight detour, and I promise you it'll be worth it, and talk about Swiss cheese. The Swiss cheese model, it was invented by a man named James Reason, and it's the basis of layered security and defense in depth. And it's used to illustrate how human error can impact layered security. It's used in a lot of different things. It's used in aviation, engineering, healthcare, and emergency service organizations. And if we wanted to give a real fancy, by the book definition, we would say it's a accident and risk causation model used in risk analysis and risk management and blah, blah, blah. But again, it's used to illustrate how human error can impact layered security. So, I mean, what does that all mean? What is this risk analysis management framework, blah, 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 blah. Simply put, in layered security, we have multiple successive layers of defenses. Because of human error, each layer will have holes in it. James Reason believed these were due to active failures or latent conditions, which we'll talk about in a second. But the idea behind layered defense is that if we have a hazard that makes its way through a hole in one of our layers, hopefully it will be stopped by one of our other successive layers of defenses. And why we're here today is that alert fatigue is a contributing factor in both active failures and latent conditions. And by reducing alert fatigue, we can reduce human error and potential failures in multiple layers of our defensive architecture. And by combating alert fatigue, it's one of the only things that, again, gets multiple types of the active failures and the latent conditions in multiple layers. So what are active failures? Active failures are the unsafe acts committed by people. They are a direct action, the result of a direct action. And we can see a lot of really obvious ways that alert fatigue can cause immediate active failures in organizations. So again, just like Target, a true positive can be classified as a false positive just due to a huge amount of nuisance alerts and false positives and things like that. A critical event cannot be addressed in a timely manner just because, again, you've just got so many other things you have to look at. In cybersecurity, the people who are really good, what we're trying to look for is really, really nuanced traffic and kind of these underlying hard to detect things. Malicious traffic is not going to be noticed if you're distracted by other things. Also, too, active failures can it can manifest itself in the form of a communication breakdown. So one of the most famous examples of this, we were going to call it the most unfortunate typo in recent history, the John Podesta email scandal. He actually took the spear phishing email he received and forwarded it to an analyst. The analyst was busy. He figured something. He says all the time he's extremely embarrassed by it. It haunts him to this day. And he wrote back when he got this email, "This is a legitimate email," when he actually meant to write, "This is not a legitimate email." And again, we all know how this plays out. When people are tired, when people are stressed, when people have an alert fatigue, they're going to make more kind of slip ups like this. So James Reason believed that active failures are caused by underlying latent conditions, which in themselves can cause holes in our different layers of defenses. Latent conditions include contributory factors that lie dormant for days, weeks, or months until they contribute to an error. Alert fatigue, it can exacerbate, it can feed into, or it can just cause a lot of different latent conditional failures. So again, maintenance can be deferred and lead to improperly configured architecture just because people are doing other things. You can have a staff that is highly stressed out, burnt out, they make more mistakes. Burnout leads to poor employee retention and high turnover. And if you have a staff that's all green, again, more mistakes are going to be made as well. And again, I think we're all kind of familiar with this here. Budget cuts can reduce staffing to unsafe levels, which in turn increases and feeds into alert fatigue, and then again, it kind of spirals off. And as we said, we're going to be looking at other industries and what they're doing. And just to kind of show some very obvious parallels, this is a graph here about latent conditional failures in healthcare. So in healthcare, how the Swiss cheese model is applied. And again, in healthcare, you can have latent failures due to lack of funding and resources. You can have failures due to incomplete policies, deferred maintenance. Different teams have bad handovers and shifting responsibilities. And at the end of the day, all these end up leading to holes which can harm a patient. So, coffee break really quick. Now we know that alert fatigue jeopardizes security and it increases human error. So where do we go from here? We need to look at design and implementation. In industrial systems, there's a lot of belief, and it's kind of a bedrock, that the alert is the property of the operator. Alerts must be configured, valuable, and usable for the people who are using them day in, day out at the end of the day. And it has, again, this underlying drumbeat that the alarm is a tool used by the operator, and it must meet the operator's specifications to function correctly. So simply put, if you've designed something that people have a hard time using, it's not working. In absence of a working policy or procedure, workers will create their own unofficial procedures that may not adequately address safety issues. And I'm going to change my verbiage here. It says may not. A lot of times it's not going to. So strategy, policy, and operations must be aligned when configuring and designing alerts. Ignoring the input of operators can, and particularly in industrial systems, has led to large-scale failures. And so operations personnel needs to realize that the tuning and the design of the alerts belongs to them, and how it functions needs to be determined by their requirements. In healthcare, and again, I do want to kind of stress here, different organizations have had different amounts of success with this. And so we are featuring more of the stories that have succeeded, and they've done peer-reviewed papers, things like that. They have research that's out in the public domain. We are focusing on that. So again, when I say in healthcare as general, please note that I am referring to the success stories. So a lot of the organizations that have had success, they are, again, doing this by basing the tuning around the operator. They want to fine-tune and customize alerts based on the subsequent operator action, which I think is really smart. So one of the things that is very successful is they're trying to identify alert override patterns. In healthcare, particularly certain systems will have an override pattern of sometimes up to 95%. So 95% of the time, someone's just clicking that button that says ignore. Alert override is highly dangerous. If operators are used to labeling alerts as false positives more often than not, it's just going to increase the chances that true positives will be labeled as false positive simply out of just a force of habit. In cybersecurity, we call it just clicking through. You start clicking through something long enough, it becomes habit. You're going to do it over and over again. And again, one of the things they talk about in healthcare is that the alert should result in a meaningful action. And if you can look at an alert that has resulted in a meaningful action more often than not, that's something extremely valuable. One of the other ways this is done is by having repeated clinician assessments of alerts. So just old-fashioned polling, asking people if something is effective, asking if the operator is satisfied with the alert. And at Vanderbilt, they have some really good studies on this. They did just tons and tons of polling. And what they just simply do is they ask people if they're satisfied with an alert. And if an alert is deemed unsatisfactory, then it goes to a secondary committee based on tuning to go from there. Another way a couple different organizations have done it is they just have committees based of operators, the people who are, again, using the alerts day in, day out, who actually have to address them, and they meet and say whether something is satisfactory or not and go from there. And this is where we need a shift in cybersecurity, and we need to view the alert as the property of the operator. And again, strategy and operations need to be aligned to discuss what needs to be alerted on, in what time frame, and if it can be reasonably done with the current staffing levels. And we have to design a process that is usable for operators in order to achieve the unified goals between operations and strategy. And in order to do this, we have to put the operator at the core of any alerting design process and the tuning as well. And what we're going to talk about in the next slide is, again, alert volume. It needs to be addressed upfront, as operators must be able to detect, diagnose, and respond before a hazardous event occurs. So volume can't be ignored. In many industrial systems, also in aviation, volume is extremely important. They have defined metrics for how many alerts an individual can reasonably handle within a time frame. Anything above this number, and pay attention to the verbiage here, anything above this number is a safety risk. It's not just stressing people out. It's not just burning people out. It's not just, oh, it was a rough day. It's a safety risk to the organization. It's a safety risk to everything. So we really do need to have this thought exercise and ask ourselves, what is the threshold for our organization? How many alerts are we asking our people to take on? One of the easiest things to do about this is to ensure that duplicate alerts are combined. A CrowdStrike survey of different security executives at large enterprises found out that 64% of alerts are redundant alerts. 64%. And where this really comes into play is a Cisco survey in 2017 found out that 44% of alerts are never investigated, oftentimes due to high volume. 44%. So if we think back to, again, that 64% of alerts are redundant, if we can just take that off people's plates, they have so much more time to focus on things that are valuable, nuanced, that can provide value to the organization overall. And in cybersecurity, you can have alerts that are high false positives as long as those alerts are low volume. But anytime you have alerts that, again, there's a high volume of and they have a high false positive rate, that's where we have danger. And in healthcare, programs that have been successful have developed an alert management protocol. And as we saw with Vanderbilt and different organizations, the constant cycle of evaluation is taking place in the alert management protocol. And they're looking at, again, alert override patterns, things like that. So this is great, this is lovely and all, you have to have an alert management protocol. In industrial systems, and to me, I think this actual infographic is the most valuable part of the whole webinar. In 2003, the International Society of Automation started developing a standard for alert management. They worked on this for 6 years, and I think it's excellent. And one of the things that we have to pay attention to is that the detailed design, implementation, and operation, that piece of the alerting is a very, very small piece of the pie, and really the change management, the monitoring assessment, and the auditing all are going on in the background and are weighted much, much heavier than just the detailed design, implementation, and operation. So again, this constant cycle must be going on in the background. Speaking of design, another kind of interesting thing from the International Society of Automation is called the consequence threshold. And if there's so many different parallels here for cybersecurity. So in cybersecurity, as an analyst, an alarm is enunciated, we are detecting it, and then we have to diagnose. So we have to pick the cause and the corrective action. We have to have a response, and that response needs to be put in place. That response needs to be put in place, and the safety of the process needs to be assured before, as we see at the end, there's a hazardous event. And so what this response time is, the response time before there's a hazardous event, it needs to be considered upfront during design. So when designing alerts and incident response procedures, we need to be asking, what is a reasonable time frame to detect, diagnose, and respond to an alert before the consequence threshold, so that's that hazard, occurs? And the response must be quick enough that the process has time to react before the consequence threshold is hit. So I'm not saying go through every single alert you have and figure out how quickly it needs to be triaged. I'm not saying that at all. But what I am saying is that this is at its base a very, very useful thought exercise, and it's very interesting to go through and think, 4 different alerts that you have, how quickly it needs to be accomplished. So again, how quickly do you have to identify and contain a credential harvesting campaign before there's a large-scale incident at your organization? Emotet's been distributed a lot recently. How quickly do you need to identify and contain a malware distribution campaign before there's a large-scale incident at your organization? One of the pitfalls I think people fall into a lot in cybersecurity is when thinking about containment measures and time, they're actually not taking into account the reasonable response time of other teams. So to continue with our phishing incident as well from earlier, if you're relying on, let's just say, the networking team, the exchange team to pull emails, block a URL, something like that, if we work with what's real, not just what's ideal, like what their actual turnaround time is. If their turnaround time is 5 days, that's very obviously outside of the consequence threshold and something, obviously a hazard could happen. So what we need to do here is prioritize alerts. Alerts should not be in chronological order. I've never found one piece of information that says the best way to organize things for alerts is in chronological order. Alerts should be based on criticality and the consequence threshold instead. Using color coding is really, really useful as well. Also, only high-level severe alerts should be interruptive. One of my friends who works at a hospital, she says she comes home and she has alerts ringing in her ears and alarms ringing in her ears, and she hears the microwave and it's like too much sometimes. Don't do this to your people. But also apply human factors principles when designing alerts, so focusing on format, content, and legibility. Communication is very, very important. And one of the things I wanted to bring up about this isn't necessarily about alerting, but it's about this communication piece and handing things off, is the ESBAR template. This was introduced to us by our friends at Michigan Medicine. It's spectacular. ESBAR is an acronym for Situation, Background, Assessment, and Recommendation. It's a technique that can be used to facilitate prompt and appropriate communication. It's used a lot of times in healthcare systems. It's how nurses are encouraged to speak to doctors, for example. It has its basis, though, in maritime Navy communication. It was used on submarines when they would do handoffs on submarines. And this communication model is excellent for, again, facilitating a handoff, things of that nature. And we're speaking about design. We're getting kind of towards the end here, wrapping it up. So we have to, again, talk about the change management, monitoring assessment, auditing, tuning, all that extremely, extremely important stuff, which is, again, the base of this whole alarm management philosophy. And from the International Society of Automation, again, monitoring assessment is key. We need to constantly be asking ourselves if what we're doing actually is sticking true to the initial philosophy of what we set out to do. So is the alert actually accomplishing what we wanted it to when we made it? But also, again, this is where we go really astray a lot of times in cybersecurity. In order to accomplish the monitoring and assessment, the change management, and the auditing, we must delegate who is doing the tuning, the maintenance, and the auditing of the alerts. A lot of times we delegate, who's going to make it, who's going to do the initial triage, but we miss out on this piece of who is actually going to maintain everything. And also in cybersecurity, we have to ask ourselves if an alert has the ability to be maintained in the first place. And if you've designed an alert that only one person knows how to maintain or tune, and no one else on your team has the requisite familiarity, let's just say it's written in like Haskell or some weird programming language, you should probably not be doing it. And this brings us to automation. Automation is extremely important for what we're doing, where we're going, but automation without auditing and maintenance is very literally, I cannot stress this enough, a recipe for disaster. The most recent example of this is the Boeing 737 MAX disasters. The MCAS system, this is a very overly reductive explanation, so I apologize for that in advance, but the MCAS system is at its core was just an improperly designed automation system that did not have the ability to be properly overridden by the operator. It resulted in hundreds of deaths. Also in industrial systems, a lot of accidents and large-scale accidents are caused by sensor malfunction. So they'll have sensors that will trigger and put an automated containment in place. If the baselines aren't updated, if people aren't maintaining them, then literally we have huge disasters. And Leanna here was going to speak about some of the automation tips we have learned hands-on from in the HSOC, what we've been doing.
Yeah, thank you, Caitlin. So I'd like to briefly provide some detail around how we implement automation in the HSOC to reduce alert fatigue. but we do so with checks and balances in place to reduce the resulting risk from ungoverned automation, as Caitlin had, talked about. So this topic is amazing and robust. One of my favorite topics, and we will actually be presenting on the idea of healthcare and automation to the Michigan Healthcare Cybersecurity Council in October. So if this interests you as much as it does me, drop your name and email in the chat, and we'll send you some more information about how to join us in October. So the automation of repeatable tasks, it's very imperative to ensure that our responders are focused on evaluating complex systems and producing a consistent result while reducing the margin of error. However, as Caitlin discussed, it's also really important to closely manage automation and specifically the program development. This is a marathon, not a sprint. So in the HSAC, we've adopted this philosophy, especially in terms of our automation program development of crawl, walk, run. And it's really important that we do so. So when you're beginning the automation program development, it's really important for us to clearly define and document our response procedures, and then look at those procedures and workflows and say, which of these tasks have a low degree of variation, and that's really your place to start. So which tasks are consuming a lot of time but don't necessarily need a human to execute, and then start small. So a great example of this would be automating intelligence enrichment. In the HSOC, for example, as we receive alerts, we're able to integrate with technologies like VirusTotal and pull down intelligence information to enrich some of the data points that we have, and really reduce the amount of time that our analysts are going out and checking different like intelligence sources, for example. And while that seems small, it's really, really impactful. It makes a big difference to the responders, and it really has a low risk of failure. So, we always have to consider when things break, and if it breaks, that's not going to significantly impact operations. So a really great place to start. We all know technology can break down, and so it's really important that we look at how to reduce that risk, operational risk, when we're talking about implementing automated workflows. So lastly, we would really talk about meaningful metrics as well. Oh, and a test plan. So we all know that they break. So it's really important that you monitor your automated workflow's health, and that you document a repeatable test plan. And every time you make a change to your environment, that you are running through that test plan to make sure that the automation happening in the background is not breaking down, critical delivery of service, for example. And then we also want to look at meaningful metrics. So this is a great opportunity because automation, what it's really built to do is collect and aggregate different disparate technologies and data sets, so that we can, speed up workflows. It also gives us this great opportunity to implement meaningful metrics, and look at some of these items like frequency of workflow executions, and where the workflow dependencies are, and workflows that require human intervention, and items of that nature, so that we have really great visibility into what the workflow utilization is, and we can tune from there. So you're probably thinking this sounds like a significant investment of time and resource into automation program build out, and you'd be right. Um, how does this investment really address the resource issue, and specifically alert fatigue? So what we're trying to do, or doing with automation, is shifting your work hours away from these remedial and repeatable works that cause the stressful information overload, towards centralized workflow management. I'm really laying the groundwork to exponentially increase our ability to respond to incidents quickly, focusing on complex, human analysis, and focusing resources on dynamic and engaging work that really allows them to grow and think in a way that's ultimately going to reduce risk for your organization.
Unmute my mic there. And just to kind of hit the point home, we've come to our second Easter egg. If you can name this man, you also get a prize, the first person. So cybersecurity is not a rotisserie chicken. We cannot just put it in the oven and set it and forget it. No, that is not something that we can do. We can't simply set it and forget it. We have to remember in the background to have this process of auditing, change management, and monitoring assessment going on the entire time. And we always have to come back to the point that the detailed design, implementation, and operation are very, very small pieces of a very, very large pie. And so kind of how do we apply this in the HSOC? Leanna, if you want to address that.
For sure. So I would describe the HSOC as a healthcare alert epicenter, if you will. And we're responding to hundreds of alerts, and we're doing so for a really unique and diverse group of healthcare organizations, and we do that in real time. So for us, implementing, an operational structure that limits our risk exposure to damaging impacts of alert fatigue, it's really imperative that we do so. So I'm going to run down some strategies that we employ to ensure our analysts are engaged in complex threat evaluation and program advancement, rather than spending their time robotically doing repeatable tasks. So the first thing we do is we work with our participating entities to make sure that the alerts we're receiving make sense in their environment and that they align with the threat landscape. Um, a great example, if you have a high volume of alerting, looking at Linux exploits for, vulnerabilities from the early 2000s, and you're a modernized healthcare organization with mostly Windows systems, that is not good signal for you to be responding to. And so you really want to take a look at where is the greatest risk in your environment and align your alerting to align with that, to address and monitor for that specific risk, and do so in a way that evolves with the changing threat landscape. We know that there's a constant evolution of vulnerabilities and exploits being active in the wild, and when we look at those campaigns, we want to make sure that we're not only hunting but setting up alerting to long-term look at what the emerging threats are. And so that's what we do here in the HSOC. We look at our alerts and we systematically evaluate whether they're strategic for the originating organization and whether that makes sense in the current threat landscape. Another item we do is we really, and Caitlin talked about this earlier, but it's really important to understand if your alerts are actionable, and eliminate noise from unactionable alerts. And a great example of this, we had some organizations in the past that maybe were alerting on malware coming out of their guest wireless networks. And this was generating a huge volume of alerts. And ultimately, you really, unless you have boots on the ground, cybersecurity professionals in the waiting room to alert people when they have malware on their phone, this
In
is
my,
not. Oh, go ahead.
in my head, people, you're like running and they're slapping the phone out of their hand.
I mean,
Like, yeah.
really, it's not an actionable alert. I'm not saying don't have that data. It's really important that we have good storage of data so that when an incident does occur, that we're able to properly investigate and have these data sources so that we can see what's happening in our environment. But what you don't need to do is alert everybody 100 times a day every time someone has malware on their phone. So really understand, is this alert actionable and what is the meaningful action that's coming out of it? And you can do that by clearly defining your response actions and automating repetitive tasks, but really want to focus in on defining your response actions. Um, if you cannot identify how to respond to an alert and what those priority conditions are, it doesn't mean it's a bad use case. It does mean that there's more development that you need to do before you operationalize that alerting. As discussed earlier, this will also help you identify pieces within that workflow by clearly defining them that maybe you can have automated. And so we also in the HSOC build tuning and alert valuation into our operational structure. Every single time we evaluate alert, we're constantly asking ourselves these questions. Does this alert provide value? How can we improve alert fidelity? So how, can we eliminate subnets, for example? Maybe this type of exploit is not relevant, and just remove signatures that maybe don't apply to our environment. And what can we do to make this alert more specific and more valuable, and look at less signal? And then look at the response process effectiveness and efficiency. I mean, we really want to understand and evaluate on a regular basis whether the work we're doing is meaningful to the organization that we're delivering that service to. And so we do that. We do it daily, we do it weekly, multiple times, and we consistently track our progress and look at the meaningful metrics that result out of those activities. So understanding items like how long it takes to investigate an alert helps you understand, if it takes you 6 hours to investigate a malware alert that ultimately was quarantined, or the threat was contained by systems in your environments, likely not a good response procedure or potentially not a good use case for alerting. And then look at the signal to noise ratio. We actually see that for most, it's really difficult to get an alert where all of your alerts are true positives. Your true positive rates are likely going to be somewhat low, and that's okay. But what you do want to do is understand how your signal to noise ratio starts out from the beginning. And as you do tuning, is this improving your ability to effectively triage and identify real valid alerts within your environment, or security events and potential incidents? And then look at stuff like how complex is your workflow. If you've got 300 steps to, something that doesn't need to be that complex, maybe it's just not a great use of time.
And also on that too, back to kind of what we were talking about in the beginning, the operators need to be to do the process. If the process you've created day in and day out, the people who are looking at it, they can't do it, that you shouldn't probably be doing it really.
Yeah, I'm sure some of you guys on the webinar today are thinking about our weekly tuning meetings, and how we consistently take a look at all of the alerts that we have in our online and offline queues, and just talk about them anecdotally, and say, does this provide value to you as the originating organization, and are we spending our time on something that actually has meaningful action? So we talk about it a lot. It's really our main purpose, and we find that it's very, very effective at making sure that we are responding to the right things. The last one is track your gaps and continuously develop alerts. So the rotisserie chicken is the perfect example. You cannot set and forget your alerts. It won't help you reduce risk. So we continuously develop alerts. We look at the signal we have, identify our gaps in what we have to correctly identify that risk. So especially in healthcare, I think people are aware that we can't just always have everything that we want. Their resources are finite. You know, it's difficult to have a perfect operations. Nobody does it. And so we track our gaps, and we continuously and relentlessly develop alerts and make sure that we're making forward progress, and that our signal that we have turned on is going to provide the most value in the long term, rather than checking the box, if that makes sense. So that is kind of a rundown of the strategies that we do in the MI8SOC. There's a lot more that we do on this, so I hope you guys join us for some of our other webinars. But thanks, Caitlin.
Thank you, Lana. So in sum, reducing alert fatigue, it increases your cybersecurity posture. It makes your organization and its data more safe. It allows operators more time to focus on valuable alerts. It allows nuanced situations to be detected. It decreases staff fatigue, and it decreases burnout and churn, which leads to staffing issues. And again, as a bonus, besides increasing the cybersecurity posture, making your data safer, you're going to have happier employees. So that's all from us today. We would really love to answer some questions and engage and everything like that. So please type in the chat. Karen will read them out. We're happy to answer any questions you have, whether it's about alerts or birding or running into a hospital waiting room and grabbing someone's laptop and saying there's malware on it. So anything you have. So
Yeah, and while everyone kind of collects their thoughts, thank you, Leanna and Caitlin. These types of things, it's always kind of, we know, a little bit awkward to have to then immediately think of a question and potentially type it out. So we'll give you some time. We wanted to thank everybody for joining us today. We actually are starting, this is kind of a kickoff to a little bit of a webinar series in which we'll be addressing some different things every month, and it's going to be the fourth Thursday of every month. And then we hope you guys will join us as well. We do something called Coffee and Collaboration every second Wednesday of the month. So our next one is September 9th. We used to do this in person, and we would tell everyone to grab a cup of coffee, and we provided some donuts and pastries and that type of thing. Obviously, as I'm sure everybody on this call knows, not really doing in-person stuff right now. But we hope to get back to that as things hopefully continue to improve. But we would encourage you to join us for the Coffee and Collab. It's a little bit different format, where it's geared up where we have a speaker from the industry talk a little bit about something they have going on or something pertinent to cybersecurity, and then we actually have a little bit more of a discussion based about it. We would encourage you to join us and get your own cup of coffee. The nice thing about these virtual meetings is that you could do that be in your PJs, we would never know, so maybe even more comfortable than just coming in and joining us. So we'll be sure to let everybody know about that. Does anybody have any questions? I'm watching the chat. I don't see anything yet, and very well there may not be. So, but we encourage anyone who would like to ask something to do so. Let's see. And actually, I'm in our questions pane, which is a little bit different. Let's see. And some good answers. So we will also send out our prizes to everybody.
Who got the
From Ken,
prizes? I'm curious.
well, we'll go over that in a minute. From Ken, we've got, could you please go back over the ESBAR slide? I think that's important.
I love the ESBAR way of communication. Pardon me. Oh, here we are. So, and this is, even if you don't do this in a formal sense, like telling people like, oh, you have to, everything has to be done on the SBAR, I've just found myself using it. So you're going to state the situation, which is a concise statement of the problem, the background, so pertinent and brief information related to the situation. Sometimes this can get a little, I try to, as anyone who's been in my talks knows, I like to say I try to keep it zippy. In background, you can't always keep it zippy, but that's a lot of the times where I put like information about the machine, the signature, stuff like that. And then analysis, like as an analyst, this is what I'm paid to do. What do I actually think is going on? And then the recommendation, which is what are the relevant next steps that you want the person to take or you think they should be taking. And sometimes this also gets a little murky too, because sometimes people may have a predefined process or something like that. And literally you just want to write, I know you have a process here, go ahead. But that's, so again, the situation, background, analysis, and recommendation. And there's a huge amount of literature about this. Most of it now, as I said, it has its base in submarine communication. Most of it now is based around healthcare. And this is a lot of people who work in hospitals. My friend who has has terrible alert fatigue, this is how she's encouraged to speak to doctors when they have an issue where they have to escalate it to them.
Okay, from Mike, are there any industry standard metrics that can measure how an organization is doing addressing some of these issues? Maybe a baseline metric that you could build on and identify what improvements need to be made to limit alert fatigue concerns?
Yeah, so the Q in CyberForce Q stands for quantifiable, as I'm sure many of you are aware, and that's because it's a really, really important part of the program. So that's a great question, Mike. We strive to have a really robust set of different metrics, and ultimately what those are meant to do is to inform, a control set. And the idea is that you can inform many different control sets, with your operational metrics that don't necessarily need to align to a specific strategy. It's difficult to say. We definitely don't use like an industry standard set. More so try to look at the strategy and identify ways that we can measure our effectiveness and efficiency to inform that strategic control set that we're trying to align to. And in the HSOC, we do that within the CSF. So we look at like the incident response section of that control set and say, how are we going to measure an idea or control, like, our alerts all measuring something like our event response time and the number of alerts that we're investigating really helps us understand how we're doing on a strategic level. So we're always looking for new ones and new ways to measure. I wouldn't say that there's, a standard that we're using. I hope that answers your question.
Okay, a question from John is, how do we become part of the HSOC?
Oh, great question. So on the last slide, if you go back, there's definitely ways to reach out to us. We'd definitely love to chat with you, phone number and email, and we could definitely set up some time to talk further.
Yeah, absolutely. And I would say, one of the nice things about sort of the way that our HSOC is set up is that we're able to scale to any size organization, as well as, we've got the capabilities to not only work with organizations in state, but also out of state, and have several entities that we work with that are a little further away than down the road. And what we found is, because of the way that we sort of do things and the way that we staff, et cetera, we've really set ourselves up to be successful and to help other organizations be successful as well in the collaboration. So it's kind of a nice thing where we're able to take different lessons we learn from each organization and apply them sort of in a larger collaborative way. But yeah, please reach out to us either via that email or give us a call. We're always happy to discuss more and certainly answer any questions that you may have. And this kind of just touches a little bit of the iceberg in terms of, obviously we're speaking specifically about alert fatigue, but would love to speak to you more and about this is one piece of the pie, and let's take a look at the whole pie. Let's see. One of the slides from Brenda, one of the slides indicated there is a limited number of alerts a person can respond to effectively at what time. What is that number?
So one of the things that I found in my research is that different industries have different ways of measuring this. And again, it's very, very tailored. And I think that's one of the things we want to take away from this is, let's see, it's probably under volume, I think. Yep. Is that no two organizations are the same. Organizations have different levels of automation, things like that. In a lot of when you actually get down to the nitty gritty of this, a lot of this to me came from industrial systems, and in a lot of plants, the operators, the engineers, like for example, some of the plants, they said the firm number was 10. But again, cybersecurity is not industrial systems, and while there are very, very firm parallels, which obviously we could see throughout the entire presentation, it's obviously it can't be a hard and fast number. And one of the things that I think is very important, that is the drumbeat behind all this, is you have to have constant engagement with the people who are actually doing that. And you don't want to be like, I'm going to spoiler alert here, the Duke brothers from Trading Places. You want to care about your employees and be asking them and checking in to make sure that they're, are you stressed out? Is this too much? How much is, if you ever hit that threshold, like make sure they know they can come to you and tell you like how much is too much. So it really does come to organic engagement with your employees. And also too, I think just from a monitoring standpoint, you can kind of see if you do have a queue of alerts, you can see when things start stacking up, and you can kind of do a little just arithmetic yourself and say, all right, once it got past 15, that's when we really started having a backlog. So also noticing on an organic level when your organization would start having a backlog as well. So,
okay. Let's see, from Mike again, is there a value in having regular live reviews and interviews with SOC personnel regularly to gain insights into their fatigue levels and then brainstorm on how to improve priority determination and speed up investigation timeframes or efficiencies?
I would say yes, it is definitely a good use of time. We make sure that we are constantly communicating in real time all day, every day about, exactly our levels of fatigue. Even just having those conversations with your people to really helps you get a better picture of how things are going in operations generally as well. And my guess is that those regular conversations will provide you with great insight into how you can, fine tune your detection capabilities in a way where you're getting the most bang for your buck, I guess.
and I think one of the really important things too is, again, it's not just having the check-in, because the check-in is still, I'm going to go here to back to the International Society of Automation. The check-in is part of the change management and the monitoring and assessment, right? That's something that has to be ongoing. But in the actual alert design, this is kind of the bedrock. The alert needs to be designed. It needs to take into account what different levels of the organization want to alert on, but again, how the operators are going to be doing it. So it's not just taking it into account after the effect. It's designing the process and designing the alert with them in mind from the beginning. Again, this rationalization, detailed design around there.
Okay, and I know we are kind of up on time, so any other final questions that we might have here? Okay. We wanted to, again, to thank everyone for coming today. We find this kind of stuff is we're excited to present it, but even more so to have a nice audience to present to. So we appreciate everyone's attendance today. And of course, as we said, if you have any questions, I'm one of those people that I'll have about 100 questions an hour from now. So please feel free to reach out to us and we will definitely get back to you. And like I said, we'll reach out to our prize winners and go from there.
And yeah, also too, so thank you very much for coming. Everyone who's worked with me knows I'm a chatty person. Do not feel shy about reaching out. If we already work with you, you know me on Teams, reach out to me on Teams, shoot me a message, add me on LinkedIn. If you want to look at my Instagram, which is all bird pictures, and say, hey, I have a cybersecurity question, I will not begrudge you that. So anyways, thank you very much for coming, and I hope everyone has a good day. So
Thanks, everybody.
thank you.